It's a great pleasure to be here and to see such a great crowd at our sixth annual Massey Grand Rounds. This year we had overflow and we had to close registration, which is a good sign. There's a downside of that, of course. We may be outgrowing our capacity to provide an interesting venue. How beautiful this is, we may have to expand. But there's a good side of this because we have outreach, of course, and I think we're now keyed into Northern Ontario Medical School, if I'm not mistaken. I think Dean Strasser's there, and that's wonderful. Also, University of Toronto, Mississauga. Now, many of you are here for the first time, and so a little bit of history just to give you some perspective on how things evolve. 7 years ago, a group of junior fellows felt we needed a forum to discuss issues of interest in medicine and health sciences, and they convened themselves. And if I can go to the next slide, I want to pay tribute, historical tribute to the founding group. And I don't know if you can see that. I'm sorry we can't turn these lights off. Is that possible? Do you have a switch somewhere? In any event, our young colleagues are now alum. They're now at the postgraduate training phase. And it was a very interesting, imposing group with Fiona Menzies, Jay Shaw, Janice Wong, Martin Betts, John Neary, Laurie Waters, John Dirks, Andrew House, and myself. We had 4 Dons there, as you can see, Andrew House and John Neary and Aubie and John Dirks. So that was the beginning, and it's evolved over time. And it's really wonderful to see the way these topics have evolved. They all seem to have a very interesting and novel social perspective because this is what you'd expect of junior fellows at the early phase of personal development. Now, organizationally, we now have expanded in a very, very organized way. Judith Seary's biomedical engineer, systems oriented, so we have many subcommittees that operate. We have systems of communication, which operates, and she has great planning experience and has produced a very broad-based program with outreach, as mentioned, which is a real important addition to our modus operandi. So we anticipate wider distribution. The proceedings will be recorded, simulcast, and webcast on the Massey Grand Rounds website. So we will be able to share this broadly nationally, which would be wonderful with other students across the country, and I'm looking forward to that happening. We're particularly pleased, of course, to have been enabled in all this by the very generous support of the Faculty of Medicine, through Dean Whiteside especially, and also the Department of Medicine through Wendy Levinson, who have been strong supporters of this initiative and have allowed the organization to expand. Now, today's topic and symposium couldn't have been more timely, given the earlier remarks, budgets coming down, concern about health, access, outcomes, not only national and provincial, but south of the border where Obamacare is being tested out in the Supreme Court. So it's on everybody's conversation list, no matter where you are. We are particularly pleased with our speaker panel this year, foremost leaders in their own area on health equity, health issues, economics, inner city life, and all that's involved. And so we continue on. It's now my great pleasure and honor to come to the final phase of my own comments, which is to point out once again that none of this would have taken place, nor would it have evolved without the support and encouragement, particularly the financial support and resources made available through Massey College and John Fraser. He's an extraordinarily masterful in bringing out the best in his junior fellowship, and his dedication to that group is unrivaled and unsurpassed. We're delighted to have you again here today. You've missed a couple of years because you've been in Europe with the journalism people, but John, please come to the podium and give your words of welcome to this audience.
I'm just here to bring greetings, ceremonial greetings from the head of college, but I do want to, acknowledge the real reason these things exist, which is Dr. Angel, and I also want to celebrate our connection to the Faculty of Medicine, which is so important for this whole enterprise, and it's a thrill to me that Dean Whiteside is such a supporter of this and is a senior fellow of the college. And I'm not going to say much more, except perhaps for the first time to confess why all this happened. The first year I was at Massey College, or first or second year, one of the great senior fellows, Professor Emeritus Douglas Lepan, was here, and I'm very, very fond of him. And he died. But before he died, he was at the Toronto General Hospital, and I noticed a procession of former junior fellows that made sure he died comfortably and well. And it struck me that every friend I make in the medical profession here will carry me through. So every medical student, every faculty member who has passed through Massey College, I have their name and number. And it's a one-man health system, but it works. So that's the non-altruistic element here. And it's wonderful that this college can support this. We're an interdisciplinary graduate college, and this is up our field, but it would not really happen if it wasn't for Aubie Angel. So it's he who I salute today. Thank you very much for coming.
So I'll give an introduction for Dean Strasser. Dean Strasser has been the founding Dean of Medicine at the Northern Ontario School of Medicine since 2002. So the Northern Ontario School of Medicine was the fourth medical school in Canada for over 30 years. And it unites campuses of Lakehead University in Thunder Bay and Laurentian University in Sudbury. Prior to his appointment at NOSM, the Northern Ontario School of Medicine, he was a professor of rural health at Monash University, as well as the head of Monash University School of Rural Health in Australia. Over the past decade, he's been recognized for his world leadership in rural health. And in 2006, he was recognized in both Canada and Australia for his efforts. He was the inaugural recipient of the Ontario Health Association's Small, Rural, and Northern Award of Excellence, as well as the Australian College of Rural and Remote Medicine's Life Fellowship Award. Oh, and he's now disappeared. Okay, you can now hear us. And this last year, Dean Strasser was appointed the member of the Order of Australia, recognized for his work and efforts. And now he's joining us via Skype from NOSM.
We'll give you the full screen.
Good afternoon, everybody. I can't see you, but I'm hoping that you can see me. Are you able to see me?
Yes.
Well, I'm very pleased to join you, albeit electronically this afternoon, and I apologise to Cathy Whiteside in jumping ahead of her. That wasn't my intention. I was just getting a little anxious that you might have left me out altogether. Here was I sitting ready to say a few words. So thank you very much for the opportunity to say these words and to welcome you all to this symposium this afternoon. The collaborative relationship that Northern Ontario School of Medicine has with the University of Toronto Faculty of Medicine is a very important one, and it's a collaboration that spans all of the academic activities, education, training, research, the whole range of scholarly activities. And it's really wonderful that the opportunity has come for Northern Ontario School of Medicine to be part of this tradition of Massey College, and in particular this symposium today, and the opportunity is there for those of us in the north to participate in the symposium through the magic of the World Wide Web. I'd like to focus now on the topic. I think this is an extremely pertinent topic in healthcare and at this time. And of course, here in Northern Ontario, we have particular challenges in terms of access to healthcare and equity of health outcomes, especially in the more rural and remote parts of Northern Ontario, and including, of course, our Aboriginal people and communities. So I think this is a very pertinent topic, and I must congratulate Dr. Angel and the student group on your exquisite timing. I mean, to hold a conference on equity in healthcare and access and outcomes the day after the provincial budget and the day before the federal budget is really outstanding timing. There really is a superb lineup of speakers this afternoon. I think eminent speakers who are really going to provide you with some food for thought and some really challenge you to reflect on your understanding of the health systems and the opportunities for improvement. And so I encourage you really to make the most of this very exciting opportunity and enjoy the afternoon. Thank you very much again for the opportunity to participate, albeit by Skype, and I hope you enjoy the afternoon. Thank you.
So up next is actually Dean Catherine Whiteside, who was appointed Dean of the University of Toronto Faculty of Medicine and Vice Provost Relations with Health Care Institutions in 2005. As Vice Provost, she is responsible for the university's partnership with 9 fully affiliated hospitals, 20 community affiliated hospitals, and health care facilities. Are those accurate numbers still? 19. Oh, that's confusing. She has also just overseen the opening of U of T Mississauga Academy of Medicine, and they are also joining us today via the World Wide Web. Dr. Whiteside joined U of T's Department of Medicine in 1985 as a clinician scientist and has engaged in basic research in the field of cellular mechanisms of kidney disease. In 1996, she became a full professor of medicine, and in 2007 was awarded the Medal for Research Excellence from the Kidney Foundation of Canada. She is past president of the Canadian Academy of Health Sciences, and in 2009, she was the recipient of the Canadian Medical Association's May Cohen Award for Women Mentors. And we are thrilled to have her here and supporting us again this year.
Well, Ryan and Judith, thank you so much for all that you've been doing, and your colleagues, many of whom are here today. This is another terrific Massey Grand Rounds thanks to your leadership. Many thanks also to Aubie and John and all of you who are participating today. Special warm welcome to our colleagues at UTM, and also, of course, to our very close friends in the Northern Ontario School of Medicine. Roger, just delighted that you are engaged with your colleagues this year. Also, a very, very special thanks to the speakers today, to our esteemed guests, Professors Hurley and Turnbull, and as well as our own faculty. I know this is going to be just a fantastic afternoon, and I would echo what Roger has always espoused as the Dean of just the spectacular Northern Ontario School of Medicine, that equity and the importance of access, particularly to our populations, whether they're rural or urban, for those who are underserviced, even in our great province and in our great country, is certainly something that we all must pay attention to and be part of the solution for. So I look forward to this afternoon, and thanks again to all of you.